our foster family, we have 10 pets. They are 3 Westies, Saffron, Belle and Beau, 5 tortoises, Herbie and Bernadette, Amy and Sheldon and Penny, and we have the 2 rabbits who are Poppy and Daisy. And the fact that there is several dogs I find really helps, because we've got several children and everybody can have a cuddle at the same time and everybody can get that attention really. The children that we've had and young people that we've had have often spent more time with the dogs initially, because you can have a chat if you want to chat, you don't get quizzed, you don't get asked anything, and they're just lovely company. So this is what we call the den, and it's our semi-independent room, but this goes down really well. It's got its own entrance, it's got its own set of rules. It is somewhere to practice being independent but safely. We're all in the house, they've got access to the house all the time. I've got a key for the den as well, so it's still one home, but this is a separate area for privacy. We've got rooms in the house for younger, under 16-year-olds. This is probably my favourite and most important thing, and it's our welcome book. So we don't really discuss this book, it's just left on the child's bed and in their own time they just go through it. But what is so important to me, because it introduces our family, there's photographs of everybody that's in our house and a little bit about them as well, what things they like, how old they are. And I think that it's, in the early days, it can be so daunting, and it's like, who am I with? And it's actually really nice to have a little bit of an explanation, and they also can create talking points. Because food and meals are such a high anxiety area for nearly all of the children that we've had, I like them to know what's coming, and I like them to be able to plan and not worry about their evening meals. So we have a Monday to Friday system, and on Sunday I'll plan out what we're going to have, and they simply just tick their name if they want it. And I have found that since we've introduced this system, I'm not getting asked at breakfast what's for tea, because children were obviously concerned, they were asking the question, and it's there, they open it up, and it's really lovely because spaghetti bolognese always goes down really well, and on Sunday you can hear the little whispers, I can't wait till Wednesday. Before a new foster child comes to join our family, it is an anxious time, but I would say it's more exciting than anything else, and we've got a lot of trust in the county council for matching us to the right placement. So before that child arrives, we don't question, are they right for us, because we're confident that they will be. I would say to people thinking about fostering to ring the local authority and ask as many questions as you can. When I tell people I'm a foster carer, a lot of people immediately say, I've thought about that, or I want to do that, and haven't. And I'll always question, well, why did you not make that call, or why did you stop? And it's often a fear that could be just, I don't know what the word is. it could just be resolved so quickly, and sometimes just asking questions and makes you realise that the things you're worried about aren't really there, or you can speak to somebody that's experienced it and gone through it, and have come out the other side and think, actually no, it is a really rewarding thing to do. I can't see myself doing anything different.
Here at Nottinghamshire County Council, our priority remains the health and safety of staff and our communities. In response to the coronavirus, we have put a number of measures in place and updated workplace policies to ensure we fully comply with the government's 5-step guidance on managing the risk of COVID-19. You can access our COVID-19 secure statement via the staff intranet. This short video is an overview of the measures put in place to help us all work safely in a COVID-secure environment. Workplaces will look and feel very different, but please remember that these changes have been made to help keep you, your friends and families safe. Please stay alert and social distance. Building signs and visual markings should help you to remember. Regularly wash your hands with soap and water. Hand sanitizer can be used when this is not possible. Avoid touching your eyes, nose and mouth. Cover your cough or sneeze with a tissue or your elbow and throw used tissues into a bin. Don't leave them lying around. If you develop any of these COVID-19 symptoms, stay at home. A high temperature, a new continuous cough, a loss of or change to your sense of smell or taste. Notify your line manager and book a test through the NHS as soon as possible. Office buildings will be open from 8 AM to 5 PM. Plan your arrival to help maintain social distancing. Even though you may not have seen colleagues for some time, please remember that there should be no personal contact. Handshakes and hugs will have to wait. Hand wash cleaning stations will be available at the entrance of every building. Please use them when you arrive on site and regularly throughout the day. You will need to sign in and out of the building. This is extremely important as we need to make sure that we do not exceed capacity. This information will also be used for fire safety and track and trace purposes. Follow the one-way systems that have been introduced when entering and exiting a building. Walk on the left-hand side and keep moving. Please don't stop to chat to colleagues and remember to give way on the stairs, allowing people plenty of space to pass. Please keep lifts free for those who really need them. Your access card may not work on some entry points in line with the new measures, and some areas have limits on the maximum occupancy. Please don't exceed them. Finally, make sure you are familiar with any changes to the building layout and emergency procedures. Workstations have been rearranged to maintain social distancing. Try not to cross over into anyone else's safe zone. If windows are available, please open them to help keep your work area well ventilated. Do not prop open fire doors. There will be no touchdown desks. Workstations have been allocated to individuals who need one, and we are maintaining a clear desk policy so no personal belongings should be left on a desk or workstation. Regularly clean your desk and dispose of any waste. Mice and keyboards have been removed from desks to aid efficient cleaning and reduce touch points. Please use your device keypad or bring one with you. Managers will organise the use of space allocated to the team, and you may be asked to sign in and out of your area. Do not sit at any desk marked "Keep Desk Free for Social Distancing" or where there are red bags covering the IT equipment. At County Hall, there will be designated areas for colleagues to drop in to print and scan work. This is not available at Trentbridge House. Communal printers should be wiped down with antibacterial wipes before and after use. Used wipes
Thank you. A warm welcome to this meeting of the Health and Wellbeing Board, which is being held remotely, with the majority of members joining the meeting from their own homes. This is the second meeting of the Health and Wellbeing Board to be held virtually, so please do bear with us if we experience any technical issues. If we lose any members from the call temporarily, then officers will seek to assist in getting them reconnected as soon as possible, hopefully without the need to halt proceedings. Officers will inform the meeting if they're unable to rectify the problem and if we need the meeting to be paused or adjourned temporarily. When participating in video conferences, please remember to mute your microphone when not speaking and avoid showing any personal data if sharing the screen. It's always worthwhile as well turning your video off if you're not actually speaking, because it uses less of the broadband. So to assist with chairing the meeting, please use the virtual hand icon in the Microsoft Teams to signify that you wish to speak. If you don't have this option, then please use your real hand. And please remember to take your hand down after you've spoken, but don't worry, someone else will if you don't. If we need to formally vote, where possible, I'll ask if anyone is against the motion. I'll then ask for abstentions and then assume everyone else is in favour. Before the formal part of the agenda commences, I'm required to ask county councillors if there are any substitutes present. The substitute will need to identify themselves and give the reason for the apology from the member who cannot attend. But first, Martin, please.
Not aware of any substitutions today, Chair.
Thank you. Any substitute? No, thank you. Item 1 of the agenda, you'll have received the minutes already as part of your information pack as a pre-read, and if not, it's on pages 3 to 8 of the pack you currently have. So the minutes of the last meeting held on the 24th of July 2020. Can the minutes be approved in as an accurate record of the meeting, please? Anyone against? Anyone abstaining? Assent will therefore be assumed and recorded. Thank you. We'll now move on to item 2 of the agenda, apologies for absence. Democratic Services Officer will now provide the apologies for absence. Martin, please.
Thank you, Chair. I've received apologies that Councillor Debbie Mason may not be here, and if she's not, I should give her apologies. Apologies from Kevin Dennis of the Police and Crime Commissioner's Office. Apologies from Colin Pettigrew. From Sarah Collis from Health Watch, who's been deputised by Jane Lawton, the chair of Health Watch, and from Fiona Callaghan, who's been substituted by Hazel Wigington. Also from Lucy Dadge, and I think that's it, Chair, for apologies.
Thank you, Martin, and a big welcome to anyone that is substituting or may be their first meeting. We'll now move on to item 3 of the agenda, declarations of interest by members and officers. Do any members or officers present have any disclosable pecuniary interests or private interests, pecuniary or non-pecuniary, to declare? As I always say at this point, it's not a problem if you don't realise and we suddenly get to an item on the agenda when you feel there is an interest, then please raise your hand then and make it then. But does anybody have anything at the moment? Thank you. We'll now move on to item 4 on the agenda. This is on pages 9 to 20 of your agenda pack, and it's the Chair's report. So the Chair's report provides a summary of local and national issues for consideration by board members. All members have received this report in their agenda as a pre-read. Therefore, I would like to highlight the following sections. On page 1, 2020 flu campaign, the County Council will again be offering on-site vaccinations and pharmacy vouchers to make it as simple as possible for frontline employees to get a flu vaccination. Arrangements are in place with partner organisations to support the uptake of the NHS flu vaccination, particularly in key groups such as young children, people over 65, pregnant women and people with underlying health conditions such as heart disease and diabetes. And let's not forget, of course, COVID-19. Pages 2 to 3 updates on County Council's commissioned services. On page 2 to 3, there are some good examples of how services commissioned by the County Council have adapted to the pandemic. Change Grow Live, which you'll see is the acronym CGL, were commissioned to deliver a new all-age substance misuse, i.e. drug and alcohol, treatment and recovery service from April 2020. The service has responded flexibly to the challenge of mobilising during the COVID-19 pandemic. The report provides further detail of this work, but I think it's important to pick out a few examples. Continued outreach has taken place through the lockdown period, with over 700 people being provided with services such as food vouchers, food parcels, I knew I'd struggle with this one, Exone kits and safe storage boxes. Home-based alcohol detoxes were launched in July, which aim to support people whilst they complete their detox at home. Online alcohol identification and brief advice training has been delivered to over 300 professionals from a range of services and organisations, including doctors' surgeries and Nottingham Fire and Rescue Service. The Integrated Wellbeing Service, named Your Health, Your Way, again with the acronym YHYW, went live on April 2020. As smoking puts people at increased risk of contracting respiratory infection and developing more severe symptoms if infected with coronavirus, the service prioritised its initial focus on smoking cessation. Since June, it has been able to provide a full service remotely, including smoking cessation, weight management, physical activity, and alcohol reduction support. People can access support through a variety of means, including telephone, online, and video conference. Plans are in place to start delivery in person following social distancing rules. The integrated wellbeing service has seen over 1,000 referrals, with smoking cessation being the primary reason for referral, and work is continuing with partner organisations to increase referrals and improve referral pathways. I've mentioned the examples, but there's a lot of other useful work taking place, including a coordinated social media campaign focusing on suicide prevention, which is designed to coincide with World Suicide Prevention Day next week on the 10th of September. The ongoing work to deliver mental health support teams in schools, work in Mansfield to tackle food insecurity, and fitness assessments with Gedling community centres. Would members like to raise any of these matters or any other subjects arising from the report? In line with the recommendation of the report, are there any actions required by the Health and Wellbeing Board in relation to any of these issues? So over to you, and I have Jeremy Griffiths first, please.
Thank you, Tony. Couple of bits and pieces really. I always think that the chair's report is incredibly illuminating and very, very useful. One of the most useful papers I actually get to read in any board work. Couple of bits and pieces. Item 4 talks about the Mid-Nots Integrated Care Partnership, social prescribing link workers. I just wanted to make sure that members understand that social prescribing is happening across Nottinghamshire. It's not just in Mid-Nots. There is an initiative in the city, and there's also an initiative in the south as well. I just have a little bit of concern about the one of the lines and some of the language in the description, where it talks about people in the first place who may be considered to live chaotic lives. I think some of that language is a little bit pejorative, and I would quite like to see language like that not actually in any of our papers. I think all of us live chaotic lives in one way or another. So effectively, what social prescribing is doing is looking at where social elements in people's lives have an impact on their healthcare. So that may be relationship issues, it may be finance, a whole variety of issues, and it's having significant impact across the county. I'd like to ensure that any work that's being done around World Suicide Prevention Day, make sure that we do get that general practice is aware of initiatives and is aware of resources. One of the things that we are really seeing in general practice is a real upsurge in mental health problems following the impact of COVID, not just around necessarily the impact of illnesses, but also the impact of unemployment and just general, I think that a raising of the level of heightened awareness in society about feeling vulnerable, and so something around that, making sure that that goes out to all our parties would be really important. I would like to just feedback the updates on the number of cases of COVID is incredibly helpful as well.
Hello, we've got some distortion on the line. If people could mute, please, while Dr. Griffiths is talking, and hopefully that might solve the problem. Thank you. Yes.
Just to say that surveillance report is incredibly helpful as well. That goes out. I send that out to the GPs across Nottinghamshire, and it's very helpful to just keep a pulse on what's going on. So thank you for that.
you, Dr. Griffiths, and thank you for your comments. Thank you very much for the feedback regarding chaotic lives. We'll ensure that that's put right in the future. As people have rightly said, a lot of us have got chaotic lives, but I'm sure we'll find another descriptive for that. So thank you. An excellent point regarding informing the surgeries when we do anything on the suicide prevention. We'll certainly aim to do that and keep everyone informed. And thank you for your feedback regarding the reports everyone's getting. I'm sure everyone finds them really useful, and they're very frequent as well. So as soon as anything happens, then Ed Shaw sends it round, and that's good that we're all kept informed from one point of view. So thank you for your comments. I've got Councillor Guilfoyle and then Amanda Fisher with a real hand up. So Councillor Guilfoyle first, please. Thank you, Tony. Yeah. Basically, I wondered if we could have an end of term report from the Change Grow Live group. Clearly at the start of that process, when the tender was given to them, there was a lot of consternation, particularly in Bassett Law, about the change in the system and the way that was going, and the treatment. And I know that both professionals and others, and there was, a lot of publicity about that. Clearly now that has sort of gone through its process over the last few years, and the changes to the new service that's just occurred obviously happened while we've had COVID and not really been meeting. And I think we would have normally have got an end of year report that we could have had the opportunity to review what was being done, and members make comment, and health professionals who are in the meeting with us be able to give another side to some of the information that we get. So I don't know if that's possible, Tony, whether we can ask them either to come and but provide us with an end of term report that they had, and again just a little bit about how they see the new service moving forward for the next few years going on, because it is an important issue. I know that there's been, as I said, there's been an issue around the suicide rate across the county. People have made links with that and the service, so I think it would be good if we could have that, if that's possible. Yeah, thank you, Councillor Gill, for an excellent point. We'll then arrange it to get a written one put out, but if not, we'll arrange a presentation at the next meeting, and I'll ask Ed to put it on the work programme. But I'll just bring in Jonathan Griffin, if I may, before Amanda Fisher, because he may be coming back on this item. Jonathan, please.
Thanks, Chair. Yes, Councillor Guilfoyle, be happy to do that. Both elements, both the look back, because actually we've got in Nottinghamshire, relatively speaking, a fairly good story to tell about the outcomes for this group of service users, and particularly when you compare that to some other areas of the country. And I think that's important that we make that clear. But also be pleased to do something that is more forward-looking as well. And you're quite right. The last few months have rather eclipsed the opportunity we otherwise would have taken at the launch of a new service to set out how that would work and to engage with partners widely on that. Subject to what the chair of the Adult Social Care and Public Health Committee might say, it might be something that in the first instance we bring to that committee. But obviously, I'd be pleased to make it available to the Health and Wellbeing Board as well. So we'll be pleased to look to that in the next few weeks. Thank you.
Thank you, Jonathan. Obviously, the normal course of action is for adult social care to meet next. So there's no problem with it going there. But as long as it comes back to this meeting, I think that's really important. And that's what we're being asked for. And I think it's a good idea. So I'm sure we can fit all that in its proper timeline. Thank you, Jonathan. Councillor Fisher, please.
Hi, thank you. I just wanted to fill you in on what we're doing in Mansfield District regarding the flu campaign. I'm going to be videoed and while having my flu jab done, to try and promote it across the district to get people involved in taking up that offer of the flu jab. So I think that I just thought I'd let the board know about that. I don't know if at some point might want to use that anywhere else or any of that sort of thing. We're working with my local GP, and we're hoping that they're going to be involved in the video and speak about it and do all that. We're still in the details of finalising all that at the moment, but I just thought I'd let the board know.
Yeah, thank you, Councillor Fisher, for sharing that. That is really good news to do that, and we've actually discussed it at the county with us doing a video for the workers of the county to be involved in it and try and get some publicity to try and encourage other people, because you're exactly right. And the key here is that it can adversely affect it if you get COVID-19. So it's really important, as I said in my report earlier, it's really important this year to really push that flu jab, and anybody at this meeting who can do anything to promote it, please do so, and if necessary, use this committee as a reason for doing it. And let's get publicity, let's get photographs out, perhaps send it to Jonathan or Ed Shaw so we can publicise it and perhaps put it all together on one website. So that's an excellent idea. Thank you. Councillor Bosniak, please. Afternoon, Joyce.
Hello, Chair. I saw that Sue had got her hand up first, but I'm quite happy to follow on because I just want to make a couple of comments. One was in relation to Glyn Guilfoyle and what he said about the drugs. I remember full well taking a bit of a risk a couple of years ago now, and it wasn't popular. That what Public Health decided to do at that time was to go for a treatment programme rather than just handing out methadone. So I knew it wasn't popular. But I'm sure, having spoken to Jonathan, it proved the right course of action to take. So I'll be happy to see a report back regarding that. The other thing was, I was interested to hear what Marcus Rashford was saying this morning about healthy food vouchers, because within the report, we look at the excellent work that's taking place in Mansfield about the food insecurity and what we're doing around homelessness, etc., and the family action that is taking place in regard to food for children. Because the thing for me is it's not just about food for children, it's about healthy food for children. So this notion of healthy start food vouchers, I think, is absolutely excellent. And I'm not a big football fan, but this is certainly one player that should be applauded.
Thank you, Joyce. Thanks for those comments. I've not got Sue on my list as wanting to speak. I presume we're talking about Councillor Shaw. Councillor Shaw, are you wanting to speak, please?
Yes, please. Thank you, Chair. I don't. My little hand thing doesn't work on my.
That's all right. No problem.
I was just comment. I had already written some comments that that Jeremy had said about the social prescribing. So I agree with what he said, and thank you for saying it's going to change, because I thought it was more general social prescribing from those three vulnerable, the things that were at the bottom of the page. But my question, additional question for that is all social prescribing back up and running now? And I'd just like to know if that is the case. And I've just got one more question, not about that, about the mental health support teams in schools. Really, really keen to know more about this. I mean, obviously it goes back to January 2019, and I'm just wondering, have we got the funding, and when will we be starting? Obviously, you know, all this we know, we haven't been in school for 6 months, that goes without saying. However, if the funding is there and it has been ring fenced, how are we going to get on with it? And also it says between 1/5 and 1/4 of the county by 2023. Where in the county, and is it coming to Bassetlaw? Thank you.
Thank you very much. Thank you, Councillor Shaw, for those questions. Director of Public Health, please, could you reply to that?
So I can pick up, or start to pick up, some of the questions around the mental health support team. On the questions around social prescribing, Chair, you might want to bring in a CCG colleague. I think Hazel Wigginton is on the line. She might speak to that one shortly. So yeah, I'm pleased that the mental health support teams, working with the CCGs, we've been able to secure funding to roll this out to schools and colleges. As I understand it now, actually across the county. But your question about Bassetlaw just sows a little seed of doubt in my mind, because this is has been done on an NHS footprint, and Bassetlaw falling into a different NHS area to the rest of the county, that did sow a little doubt in my mind. I do see, though, under paragraph 17 that that's going to include Bassetlaw as well. It's very top of page 12 of 46. So I can provide you some assurance on that particular point. In terms of the timescales, I need to come back to you with more information around that. Chair, I wonder if that sufficiently addressed the question. At this point, you might want to bring in Hazel to speak to the question about social prescribing.
Thank you, Jonathan. Just one point. If when you reply regarding that question, perhaps you could include everyone on the board on it as well, please. Just
Sure.
do an email to everyone so we're all clear on that. Hazel Wigington, are you able to answer the second question, please?
So just to sort of say, the CCG has given the go-ahead for it was two mental health contracts that have been decommissioned in the city. And the CCG has given the go-ahead for us to start to look at and explore how we put those mental health support workers into our existing social prescribing teams. So we're just in the very early planning stages of that, and we're looking at perhaps setting up a task and finish group to take that forward. Does that answer your question? Yeah.
Thank you. Yeah, that answers the question. Thank you, Councillor Shaw. Dr. Griffiths, please. You're muted.
Sorry, no, my connection was slow. And it's not doctor actually, councillor, but I'm just a chief.
All right, sorry, I do apologise.
No problem. Just picking up on Councillor Shaw's questions there from a Bassetlaw perspective. So Bassetlaw CCG have invested further in mental health support to schools. So there is an expanded service that is in place and ready for the schools opening. And in terms of the link workers, yes, they are up and running. They never really stopped, but they were targeted more on supporting the vulnerable during COVID and their shielded patients and others. And as Dr. Griffiths has said earlier, we have seen an increase in the number of particularly young people presenting with self-harm and other anxiety issues. So we're both supporting those who remain sort of most at risk from COVID, but also, you know, those that have suffered the consequences in a different way in terms of isolation and impact on their development and sort of that social interaction that they've been missing. So yeah, we're investing in both and link workers back up.
Thank you very much. Any other questions, please? No other questions. Thank you very much. Everyone in favour of this report? No abstentions. Thank you very much. We'll now move on to item 5, which you'll find on pages 21 to 34 of your pack, and it's the local outbreak control, learning and next steps. So this report summarises recent learning on local outbreak control, and Jonathan Gribbin, the Director of Public Health, will talk us through the learning from outbreaks in other areas and learning from a recent exercise undertaken by the Local Resilience Forum. This includes a PowerPoint presentation, and as Jonathan goes through his presentation, I'd like you all to have the recommendation of the report in mind. Specifically, are there actions that the Health and Wellbeing Board members can take to strengthen the local outbreak control arrangements? And can members highlight any additional considerations for future versions of the local outbreak control plan? And how could Health and Wellbeing Board partners contribute that? So I'd rather it wasn't just a front-loaded presentation. I'm hoping that you will contribute afterwards and look how we can take it further in the future. So over to the Director of Public Health, Jonathan Gribbin, please.
Thank you, Chair. So before I get into the presentation itself, let me say a couple of words by way of introduction. Right across the system, if you were to talk to Health and Wellbeing partners, Health and Wellbeing Board partners around the table, many of them would be talking about strenuous efforts underway in terms of recovery from COVID. and so that's focused very much around getting back to something as near to business as usual that can be sustained at the moment. It would include standing up again much of the focus on prevention and addressing health inequalities, which to some extent was paused during COVID-19, and particularly when we were in lockdown. And actually, you know, if we were wanting to make a very comprehensive take a comprehensive look at everything going across the system, it would embrace and address all of that recovery work. What I'm going to do this afternoon, though, is to focus back down very much on something that relates much more to response to COVID-19, not because it's the only thing going on in the system, but nevertheless, it is something that's very important. It's something that's absorbing the bulk of our time within public health function, and a considerable amount of resource from some of our partners too. And what I want to do, as Chair set out, is to set out for you some of the learning that arose from a recent exercise that we ran in Nottinghamshire, to give you some visibility of some of the learning that we got at that time, and to and through that to stimulate your thinking about other things which your organisations can contribute to local outbreak control, things that your organisation and agency can do to strengthen what we do to stop the spreads locally. You might also identify other things that I might attend to as well, and I'd be pleased to hear those at the same time. I will start briefly with just a quick situation update for you around coronavirus before I get into the results of the exercise itself. I'm going to what Ed is putting up on the screen now are a couple of excerpts from the weekly surveillance report which we've been publishing. And I'm going to focus in for a moment just on the what is central to the screen at the moment, the bar chart at the top, which shows some bars in blue and in orange. And that shows a timeline that runs through from the end of March right up to middle or end of August. Some of you will be familiar with the shape of that already, and we've all seen it in the media. And it shows that back in April, the count of new cases in Nottinghamshire reached a peak somewhere around the middle of April and was in decline through to the end of June. And then through July plateaued, and then we have started to see through July and into August a small but steady increase in the number of cases in Nottinghamshire. And actually, you can just about make out, if you're prepared to use the eye of faith a little bit, that at the very right-hand side of that, towards the second half of August, you can see what might be the start of a downward trend again. So that reflects pretty much the national situation. Whereas back in March and April, many of those who were diagnosed with coronavirus were older people and, relatively speaking, more vulnerable to the to adverse consequences of coronavirus. Latterly, through June, July, and certainly into August, almost all of those being diagnosed with coronavirus are of working age, and the numbers are much smaller. And certainly, if you were to look at the sort of immediate acute consequences and NHS activity arising from those diagnoses, and certainly hospitalisations are almost negligible now, certainly compared with what it was like back in April and May time. So that really describes the general situation in Nottinghamshire. The increase that we saw through July and August was driven by a mix of things. Some of it is simply sporadic cases or very small, really relatively small outbreaks. And of course, also what we saw going on in Newark, and I'll comment on that a little bit more in a moment. Next slide, please. I'm simply going to draw your attention for the time being to the line chart towards the top right-hand side of the screen. I suspect that it's rather small on your screen. It represents a timeline again. Each of the coloured lines represents a different district or borough within Nottinghamshire County, and on the vertical axis, what we're showing there is the number of new cases. And you can see that from about June, July, in most of the districts and boroughs, by that time, certainly July, most of the lines were almost flat, not quite flat, but almost flat. And that was showing that actually the increase in new cases week on week, day on day, was very small compared with what it had been back in April and May time. What you can also make out over on the right hand side is at the very top, the dark blue line shows Bassett Law, and you can see that that has continued to rise, not at an alarmingly steep rate. Nevertheless, it has continued to rise. And then towards the bottom of those lines, you can make out just about a purple line, which represents the new cases in Newark and Sherwood. And that during August, that rose really very steeply, and that's reflecting all of the new cases that we were seeing, particularly around the Newark town area. What I really have to report to you on that in terms of a situation update, I'm pleased to say is now much more encouraging than it would have been 2 or 3 weeks ago. At that point in time, the incidence rate across the whole of the district was well in excess of 30 per 100,000. And most of those occurring around Newark town itself. I'm pleased to say that as of yesterday, the rate across Newark and Sherwood as a district was less than 6 per 100,000. So it's now come right down, and that's really a reflection largely of the hard work and discipline shown by many residents, communities and employers across Newark and Sherwood in particular, and I'd want to acknowledge that, as well as the very strong partnership working that's existed with partners like Public Health England and Newark and Sherwood District Council in particular. So I'm happy to say that by next week, in the week after, when you see the refreshed version of this report, I'm expecting to see that purple line flatten out very pleasingly. So that's really intends to be just quite a brief update for you about the situation across Nottinghamshire as a whole. Perhaps we could move on to the next slide, Ed. How we do it? That's okay. So you may be you'll perhaps be aware that government categorises areas in 4 different ways. Where we all wish to be is business as usual as far as COVID is concerned. And that means business as usual these days means coronavirus is in general circulation. But where it's occurring in local outbreaks, those are being quickly identified and promptly addressed. And that's where we wish to be across the whole of Nottinghamshire. Where we've been for Newark and Sherwood in the last several weeks is that it's been flagged up as an area of concern. In other words, that's one notch up the level of escalation. If we'd been found ourselves unable to manage things sufficiently well, we would have quickly found ourselves being moved up and escalated to becoming an area of enhanced support, or indeed an area of intervention, and those represent successively more intensive levels of input from national government. I am optimistic that by the end of the week, Newark and Sherwood will be moved back down from being an area of concern back down to being business as usual. And if that is the case, and assuming nothing else nasty has happened elsewhere in the county, we'll have all of our districts business as usual. The comment down the left-hand side is worth just noting. The word outbreak can be applied to a whole range of situations, from situations where you have just a couple of cases where there's evidence of a link between them, right through to something as big as what we've seen in Leicester, and everything in between. So sometimes when we talk about managing an outbreak, public health colleagues will be talking about managing an incident where there are just 2 or 3 linked cases. In other circumstances, we're talking about managing something more of the scale of what we've seen in Newark. Next slide, please. I will just draw out a couple of points from this before I move into the exercise itself. It provides a bit of background and context for you about some of the arrangements currently in place. And the first is to say that the local outbreak control plan is very much a collective endeavour from just about all of the organisations sat around the table at the Health and Wellbeing Board, and certainly all local resilience forum partners. The work very much is focused around an outbreak control cell, which is meeting daily. And the purpose of that cell is two things. First of all, it's to monitor the surveillance data on a daily basis. So for the most part, that is about monitoring information about new cases and also soft intel that comes in from around the county and from environmental health officers and others, which complements some of the hard data. The second reason for that, second purpose for the outbreak cell is to identify where that surveillance data indicates where further investigation or intervention may be required. And where it is required, an incident management team is stood up. And that might be an incident management team that ends up meeting just for 2 or 3 occasions, or it could be, as in the case of Newark, something which ends up meeting daily, perhaps for as much as several weeks, until an outbreak is properly contained. Other structures that we've got in place at the moment is a COVID-19 protection board, which is co-chaired by myself and my opposite in Nottingham City, and that oversees the work of the outbreak control cell. And in Nottinghamshire County, we also have a COVID-19 engagement board, which is chaired by the leader of the county council, and also benefits from input from a couple of leaders from districts and boroughs, and also colleagues who represent senior stakeholders from across the local resilience forum. Next slide, please. So turning then to the exercise that we ran at the end of July, there were 2 main objectives in mind. One was around raising awareness of the local outbreak control plans and spreading that information more widely. So there was a communications and training element to this. At the same time, there was also an element of wanting to test out those procedures, running to test them out against a scenario and enable ourselves and our partners to identify parts of the plans that might need further strengthening. And those were really the 2 main objectives. Next slide, please. It drew together more than 100 people from right across the county, from all of the agencies who work together in the local resilience forum. And we, for the second part of the session, we split into 7 different syndicate groups, which enabled a more sort of free-flowing discussion between a smaller number of people. And the scenario was based around an outbreak, which in the first instance centred around university students, but quickly spread out and became a community outbreak. We'll be taking a formal report from that to the COVID-19 Protection Board. But what I want to share with you now is some of the substance of what we found in that exercise. So I will highlight just a few things to you that will form the basis of the report. In the first instance, a lot of partners were asking for greater clarity around the communication channels which will be used when an outbreak occurs. And we will formalise this, and I think it's perhaps as much about our communication, making known those arrangements, as about putting them in place. What we have in place at the moment in the daily outbreak cell is an environmental health officer embedded with us in the outbreak cell, who over the last several weeks has strengthened the links back to, in particular, the district and borough teams and environmental health teams. So that provides one of the routes by which we will communicate. If something significant did emerge out of hours, and emerged quite quickly and couldn't properly wait until normal working hours, the channels we would use to alert the the people in the appropriate agencies would be the ordinary emergency response contacts which the local resilience forum routinely maintain. So we would want to use those routine arrangements rather than coming up with something fresh and different. Next slide, please. So at the top of the screen here, forgive me, this writing is going to be rather small on some of your screens, but this picks out the relevance of cross-boundary working. Outbreaks that spread to the community, at least, are rarely going to observe political and legislative boundaries. And you will be reassured to know that within Nottinghamshire, the outbreak cell works on a joint city and county basis. And if you were to observe yourself what goes on there, you would be hard put to identify who was from the county public health team and who was from the city public health team, because we're fully joined up and collaborative in that effort. Nevertheless, you'll also want to know that I've got close links and meet formally on a weekly basis with my East Midlands Director of Public Health counterparts, and often more frequently than that. Where I think I need to work hardest to strengthen the links are with my counterparts across the border into South Yorkshire. And Idris and Councillor Shaw, Idris Griffiths and Councillor Shaw will be reassured to know that I have links there with the DPH from Doncaster and with Rotherham. But I think those are the links where need to make sure that that actually they're formalised, so that if, for example, I'm unavailable, or my counterpart who I might happen to know personally in Doncaster is not around, that we've got good systems underpinning our communication across those boundaries. So that's a work in progress for me. Moving on down, this really picks up the importance of business continuity, and this is very much something for each of us in all of our organisations. And I think board members will want to satisfy themselves of the business continuity arrangements they have in each of their organisations, and that were we to find ourselves with a major outbreak in your locality or across Nottinghamshire in the coming months, that you've got up-to-date, well exercised and well rehearsed plans for maintaining business continuity over that period. And you may have heard in the media that local resilience forums recently received information from government about the reasonable worst case scenario against which we should each be exercising and testing our plans. Now, just to underline, this reasonable worst case scenario is not a prediction. It is not a forecast. It is simply a planning scenario against which LRF partners are encouraged to test their plans. And that's been communicated through the local resilience forum within the last couple of weeks. Next slide, please. Just a few more things to run through, and then I'll reach the end of this. This is also a point relevant to partners around the table, and especially to those who routinely are involved in providing and receiving mutual aid. And this is a prompt here that local authorities in particular need to make sure that relevant services are aware of the arrangements for making and receiving requests for mutual aid. And that again would be something that would should sit alongside, I think, your business continuity arrangements. And I will at this point just mention the responsibilities which will be coming to local areas for increased responsibilities in relation to contact tracing. I've formally registered an expression of interest in taking on responsibility for some elements of what up until now have been performed nationally by the NHS test and trace system. And you will perhaps be familiar from what you've heard in the media that not every part of that functions as effectively as we would want, and that where local authorities have taken on responsibility for that, they've been able to deliver that more effectively. So that is something I'm exploring, and district and borough council chief execs are aware that as soon as I have more information about that, I'm wanting to pick up the conversation with them about how we can work together on that. And I think that will pick up the point about mutual aid, because if, for example, we had a really big outbreak in, well, let's say in Bassetlaw, I think it is likely that although I know that district council colleagues at Bassetlaw would be keen to be undertaking some contact tracing, I think they would probably need mutual aid from others, from the public health team and potentially from other districts and boroughs around the county. So that would be one example of where mutual aid would be really important. Under 16, this is really about awareness raising, and that is a work that remains a work in progress. Some of that I'm seeking to do today by making you all aware of some of these arrangements, but I'm also this will be an ongoing work through the local resilience forum, which we address potentially through further exercises, and by focusing the tactical coordinating group of the local resilience forum increasingly on the work of the outbreak cell, which will need to continue for the next several months. Number 17 picks up the point that local authorities have now, upper tier local authorities now have vested in them some additional powers which they can exercise to contain outbreaks locally. And I mean, very broadly, you will have heard this referred to as local lockdowns. Some of the local lockdowns you've heard about will have been applied through national government exercising their powers, and in other cases it will be where local authorities themselves have exercised these powers. And there will be a paper going to the County Council's Adult Social Care and Public Health Committee to set this out in detail in the next 10 days or so. And you will want to know that I'm also in touch with district and borough councils and with police and working closely with all of them about how this will work. And then finally, point 18 is about incorporating the lessons learned from exercises like this back into the outbreak control plan and the each of the incident management plans which sits behind our outbreak control plan, and that is also a work in progress. Just next slide, please, which will just prompt me about anything else. No, that was okay. So this last slide we can pick up shortly. It is simply a reminder to Health and Wellbeing Board partners about some of the prevention messages which we each need to be promoting. But Chair, if I may, I will stop there and just allow you to come back with any questions, which I'd be happy to field.
Thank you for the presentation.
A couple of comments myself. Just first, some part of the current COVID-19 is the identification of clusters of new cases and quickly containing outbreaks as they arise. This is so important because early identification can be dealt with more effectively. And again, locally an outbreak control cell meets daily to review information about new COVID-19 and identify where further investigation or action is required, again, for the fast action response. First speaker I've got is Neil Misson, please.
Thank you, Chairman. Well, firstly, I think looking at the local, shall we say, the situation in Newark and Sherwood, I'd first of all like to say thank you to all of the other boroughs and districts for their support over the last few weeks. I think it's one of the key learning points is teamwork, of pooling resources where necessary, because one authority won't be able to handle everything itself. But looking at learning points overall, I think, although it's not really come out in the report much because it's a scenario rather than the real situation, is public communications and letting the public as a whole in the wider community understand what is actually happening and what is going on. There was a lot of misinformation running around on social media within Newark in particular over the last few weeks, and Jonathan, your reports were getting into the local newspaper, and they didn't seem to be reported very widely. So I think that's the key thing that I'd feed back as a learning point. Apart from that, thank you everyone for your support.
Thank you, Neil. Jonathan, do you wish to comment on those, please?
Just briefly yeah, I agree, Neil. It absolutely requires a partnership effort. In terms of dealing with the media, yes, I think latterly what we've started to do is to try and use a more diverse range of media than those which I might traditionally look to myself. I think, nevertheless, that even so, we find ourselves very challenged to effectively address some of the misinformation that is floating around, and alarmingly, even in the last week, we hear some very alarming and unhelpful, indeed very destructive messaging going around social media in regard to school children and how authorities will be planning to protect our school children as they go back. So anything that Health and Wellbeing Board partners can do to help us promote the positive messaging and to ensure that message gets through into all of the media, that would be your help with that would be really appreciated. Thank you.
Thank you, Jonathan. I've now got Dr. Griffiths, followed by Councillor Colin Tideswell, Councillor Joyce Bosniak and Councillor Shaw. So Dr. Jeremy Griffiths, please.
Thank you, Jonathan. Comprehensive as always. I've got 3 points really that I'd like to three brief points I'd like to raise. One is about the lessons around the first wave of COVID, and just to ensure that we are understanding potentially for if we do get another wave as we go into the winter, another significant wave, about the lessons around behaviours, and that particularly around things like patient behaviour. In terms of, we found that our emergency department was 50% occupied, whereas for months beforehand we've been struggling to meet things like the 4-week wait targets. We had significant drops in attendance in primary care as well. And I haven't really seen anything around the learning around that, about actually understanding some of the factors around that. Because obviously the concern is if people aren't actually attending, and then that translates out into later presentations for other conditions, then that's collateral damage that we just need to try and minimise as well. I would like to ensure that the changes in function of services is also well highlighted and understood across partnership organisations. I mentor the social prescribers across the county, and one of their concerns is about social care not entering people's homes as it was doing previously, and the knock-on effect of that. So just making sure that dissemination of service availability and continuity is still lessons are still being propagated. I think obviously the prevention message is absolutely crucial, and I think that health messaging is notoriously difficult anyway, changing the behaviours of individuals who may well feel that they don't want to be bothered by what's happening around COVID. I just want some reassurance about some of the novel ways that we may well be actually getting those messages out, particularly to young working people who may well be the ones where potentially spread takes place. And and also around the flu campaign that's coming up. The last thing that Nottinghamshire needs now is an explosion in cases of influenza at the same time as we get a rise in coronavirus. And I guess it's just to get some reassurance that the visibility that we did, I think it was really successful on street banners and bus stops around COVID, that same intensity will come out on the flu campaigns as well, because flu has got the potential to have exactly the same impact. If we got a pandemic flu, for instance, I think the markers from the east are that we're not seeing as many cases as we were doing. It doesn't look like there's going to be a pandemic from a flu perspective, but it's not impossible. So just make sure that the vigilance is raised there. Sorry about that. It's a bit long, but it's a big issue. So.
Thank you, Dr. Griffiths. It's always better to have a long question. So we've got plenty to go at. Jonathan, do you want to do this one first and then perhaps see if the Corporate Director of Adult Social Care wants to come in on relation to the social side of it?
Sure, thank you. So Jeremy, thank you for those questions. So lessons from the first wave. Let me pick up just one of them and link it back to your point about flu, if I may. So in the first wave, we saw the impact and burden fall disproportionately on certain parts of the population, and we could comment on the health inequalities in several different ways. The one that I'll pick up, which is very obvious but very alarming, is the extent to which this impacted older people in particular. And I think the way I just want to link that back to your point about flu. I think the concern, or a concern which all of us should have at this point, is that just at the moment, the relatively modest number of new cases we see in the county is mostly amongst people of working age, who for the most part, thankfully, aren't especially vulnerable to coronavirus. But if we see those numbers increasing, the concern is that actually we see this creeping up the age bands, and that we then find that more and more of our older people and those who are more vulnerable are getting infected and will then find themselves having to deal with the adverse consequences and complications of coronavirus. So I think that sort of links in then with your point around flu, and what are we going to do as a system around flu. I think the question is perhaps best addressed to NHS colleagues who lead on the flu planning, but within the county council, we're working on two fronts. We're working really hard this year to see another year-on-year increase on the number of frontline workers who take up the offer of a free flu vaccine. And that's really important to us. Starting from a fairly low level of uptake, frankly, a few years ago, we have seen year-on-year increases, and we want to build on that again this year. And then looking outwards to our residents and our community, yes, absolutely. We've already taken a decision as a council that we will be investing in that kind of public promotion, the street banners, lampposts and so on, which will complement the work of the NHS in leading the flu campaign locally. And then finally, I'll comment really briefly on some of the prevention messaging. Yeah, we want to get that right. I don't think even now that we are necessarily comprehensive and particularly innovative about our communications, but our comms colleagues working in the communications departments of our respective organisations are often a lot more imaginative and creative about this than colleagues like I am. So Jeremy, an opportunity for you and for me and for everyone around the table is to be prompting our comms colleagues and giving them the support they need and indeed the resources in some instances to be able to come up with a really comprehensive and effective communications package. Thank you.
Thank you, Jonathan. Jeremy, in relation to your social care questions, would you like to just say the question again? Because I've got the Corporate Director of Adult Social Care who can answer the question for you if your question's not already been asked.
Yeah, it's just it's not something I can quantify, but it's just qualitative comments from the social prescribers who are, as has been described before, in contact with people who are having difficulties with non-medical issues that are presenting in a medical way into general practice, and just some of the concerns that they've expressed about what they see is a reduction in the amount of contact between social care, direct face-to-face contact, because of not actually entering people's homes. I don't know what the current situation is. I don't know what the policy is. It would be just useful to know that, to be able to reassure those social prescribers that there isn't a significant change in what's actually happening, or to just get an update as to what is happening.
Yep.
Thank you,
sure.
Jeremy.
And then I'll touch on the what we're doing about social care workforce and flu actually as well afterwards. So in terms of adult social care, we haven't stopped visiting people at home, but there are a range of different measures in place for different organisations. So clearly we are operating using PPE, and we have done since the outbreak. We have, though, implemented a policy to keep people safe as well as our staff safe, that if we can operate without a face-to-face visit, we will do so. But in terms of our messaging to staff, we have not since the start had a message where we don't visit people at home. The visiting to care homes has been restricted. So obviously care homes are businesses in their own right, and they have a duty under the Human Rights Act as individual businesses to protect the rights of their residents. So we have to adhere by the visiting policies for routine work, such as a deprivation of liberty assessment. But if there is a safeguarding issue, we will still be visiting that person in a home. But there have been some limitations as to how we work. In terms of what social care has looked like since the pandemic, what we saw early on was a real drop in our demands. So we saw that referrals to the safeguarding hub, the MASH, had dropped significantly early on through March and April, but they've actually now, they recovered through June, and we're now seeing an increase in demand that we've never seen before. So the adult safeguarding referrals have increased by about 25% in the normal activity. So there is sometimes a delay to getting a response to that, and that really has been because we're seeing that our professionals and other colleagues are starting to restart their businesses, so people are starting to get back almost to normal activity and seeing people again, and that's led to this huge increase in referrals, many of which are actually not appropriate. So there may be some issues around some of that safeguarding work. Some of the services that we commission, either through adult social care or public health, have moved to different operating models. So I think most of the services have access to some degree, but the degree of access varies. So for example, if we take some of the substance misuse services, they use some really creative ways to be able to give access to people being supervised to use methadone or using virtual clinics. There's a whole range of things to continue that service. But I think it'd be fair to say it wouldn't feel the same maybe to how it felt before, but there certainly has been access. Whereas at the other end of the spectrum, so things like our day opportunity services and a lot of the social inclusion work, that relied on bringing people together who were vulnerable to COVID in groups. So running classes, dementia groups, memory clinics, activities, outings, and clearly under COVID, it's absolutely not possible to provide that sort of work safely. So a lot of those services can't operate in the same way. So operate those sorts of groups, taking people on trips, going out in the bus, that kind of work. But what they have done is move to working on an individual basis. with people, and that is probably going to continue for some time. So as we all know, the official planning guidance is that there isn't going to be a vaccine this calendar year, and from an adult social care point of view, we're planning on working under this basis for the next 6 months. That's currently where we are. So just in summary, statutory services have been business as usual right from the start. That hasn't shifted. So staff are working remotely at home because we can't work in offices, but we're working with people directly. Adult safeguarding services are under extreme pressure at the moment, so there may be some delay sometimes in a referral getting a response. But for urgent issues, we have an ability of triaging that. And then the whole bit of what you would call care more broadly, there's a whole range of different operating models in place. So hopefully that helps clarify that. But do let me know, Jeremy, if it doesn't. And then in terms of the flu, it's going to be an absolute priority for us ensuring that our workforce and the workforce of the care market have a vaccination for flu this year. So we've already started the process about making that happen. Through COVID, we've got a daily communication link with our social care providers, so home care providers, care homes, supported living. And through that mechanism, we're already starting to promote the flu vaccines. That is going to be an absolute priority for us. And we aim every year to have 100% of our own workforce vaccinated, but clearly there's a choice there. So we do what we can without, because we're not allowed legally to make somebody have it. But that is going to be a real priority for us as a council, in making sure that social care workforce is vaccinated, because clearly our staff are a key risk to vulnerable adults due to the flu. So hopefully that's helpful.
Thank you, Melanie. Jeremy, is that it was quite a detailed response to a detailed question. Does that answer all of your questions, please?
Yeah, absolutely. I didn't mention about the nursing home side of things, but I'm sure Jonathan will bring that at some point. But just to make sure that the changes that we did put in place around the nursing homes are doing what they say on the tin, because I dealt with one nursing home this week that's had another two patients that have come down with it, so it's not gone away, and we still need to be vigilant around those most vulnerable in our society. Well, thank you, both of you.
Okay.
Thank you, Jeremy. So I've got Councillor Colin Tideswell, Councillor Joyce Bosniak, Councillor Sue Shaw and Jane Lawton. So Councillor Colin Tideswell first, please.
Good afternoon, one and all. I'd like to say well done to everybody who's put together the Appendix 1 learning from outbreaks. Very comprehensively done and put together. Well, when you think in the light of it, people are still on, it is quite a novel quantity that we're dealing with. It's nice to know that there's no complacency going into that, which is a very positive. One thing that has been made aware of from a couple of councillors in Broxtown is the fact to the east of Beeston, we have a lot of HMOs, homes of multiple occupancy. They are quite wary because they're close to the university. We know the university, those that are on campus, they've got a set protocol sorted out. But you do get a lot of second and third year students using these HMOs. Plus, you've got young couples using them because they are the cheaper end of getting their independence together, and you do get an elective mixture of people using HMO, and one wonders whether it would be worth, where we have high concentrations of HMOs, as in Beeston East, whether we should be covertly flagging the possibilities of, because there is that narrowness. You've got what used to be, say, 2-3 bedroom semis. You've now got 5 bedrooms, 8 bedrooms in that semi now. So you've got that close proximity. And we are worried about the possibility of where we've got a lot of HMOs being a hotspot. So we would like to put that to you and see how we approach that. Okay, thank you.
Chair, would you like me to comment?
Councillor Harper, I think you might be on mute.
Now it's, am I not coming across?
I can hear you now.
Yeah, over to you, Jonathan. I'm obviously having problems at this end, so over to you.
Okay. Thank you, Councillor Tideswell. Yes, you're absolutely right. Across the country, houses of multiple occupation have been identified as one of the settings where we need to be particularly vigilant, and where you have a student population as well. I think we're all anticipating that that's something that we need to watch really carefully. So, oh, and incidentally, I should also add that in Newark and to an extent in Bassetlaw, where we over the recent months we've dealt with outbreaks of varying size, houses of multiple occupation have been identified as one of the factors there. There is in Nottinghamshire, we have an incident management plan that is built around universities in particular, and that's something which colleagues have been fine-tuning over recent weeks in anticipation of the return of students, well, this month now, over the next few weeks. So it is something we'll be watching really carefully. In the outbreak cell yesterday and today, we were giving particular attention to students in general, and your point about houses of multiple occupation did come up in connection with that. So thank you for the prompt. It's something that we're going to need to continue to keep in mind going forward.
Thank you, Jonathan. Yeah, Councillor Tideswell, when I was Chair of Strategic Planning at Broxtowe, I did include that into the core strategy. So hopefully you'll be able to find mention of it there. Next person, Councillor Joyce Bosniak, please.
Thank you, Chair. Just a couple of points. One, I'd like to follow on from something that Jeremy mentioned, and that was about nursing home care. So the issue for me is that, and I've already raised this with Jonathan previously, is about an individual who was diagnosed with coronavirus 4 days before she died, and yet the death certificate recorded that incident as the death as frailty and old age. Now, that concerns me considerably, because it then starts to point to the accuracy of the information that we're working upon. I have previously asked Jonathan to give me some assurances that this happens very rarely, but because Jeremy's with us today, I thought I'd just mention that it was the GP that would, on the death certificate, had said elderly and frail. So that's just an example of where questions need to be asked about how we are determining what is COVID and what isn't. But the other question I wanted to ask was around what's been happening in Manchester currently. Now, in Manchester, of course, just today, there was supposed to be a relaxation of the lockdown. That has now been changed. Now, for me, I want to be sure that if there is such an incident in Nottinghamshire, that the communication between national level and local level continues, because I don't want to think that the government decides to overturn some lockdown agreement that we've reached, because that starts to affect our credibility and also the public's confidence in what we're saying. So just clarify for me, Jonathan, exactly who's going to determine whether there's going to be a lockdown in any given area, and does the government still have the power to override that? And I'm happy to see that the government has changed its mind now and has listened to what the people of Manchester have been saying, Public Health in Manchester have been saying, and decided not to relax that the powers for lockdown. I just don't want to see that happening. It shouldn't be about U-turns and people changing their mind. It should be about, let's get it right from the very start. I just believe that's so important for our credibility, really. So that's my question.
Thank you, Joyce. Thank you, Joyce. I also heard that on the news today as well, so it's quite cognate. Jonathan, please.
So in relation to your second question that was reflecting on what's happened in Manchester, so first of all, I should say that we are absolutely focused and intent on avoiding the need for any form of local lockdown, whether it's something which we determine or whether the national government determines it. So that is why it's so important that all of us continue to uphold and promote all of the basic messaging around how we can stop the spread in Nottinghamshire. It's not a new message. It would be lovely to come out with something new, but it is going to be so important to us in the coming months. To address your question very directly, though, it's in Nottinghamshire that we will determine what happens in terms of lockdown, and it is also true that that government reserves for itself the right to overrule and the Secretary of State has powers that he can use either to bring in a local lockdown if he perceives that a local authority has been too slow, or indeed if he feels that a local authority has gone too far, he has powers to actually rescind a local lockdown. So it's something which we will determine locally, and it's also true that government reserves powers for itself to override.
Thank you, Jonathan. I've now got Councillor Sue Shaw, followed by Jane Lawton and Councillor Henry Wheeler. So Councillor Sue Shaw, please.
Yeah, thank you, Chair. Can I first say a massive thank you to Jonathan. Thank you for your presentation, but you know, your day-to-day work, I know it's your job, but even so, it's absolutely amazing what you and the team, and then obviously it links back to Bassett Law. I know the work that linked with Craig and all the stuff that's going on. So I just want to put out there a massive thank you for your commitment to doing this. A couple of questions is one about comms really. The link to the Doncaster and Bassett Law Teaching Hospital, the trust has been absolutely amazing with their comms about COVID patients in and out and all the rest of it. And I was wondering whether we're going to have a similar one from GPs across the district, because we're now starting to see on social media, and we don't want to have to keep responding to this about well, you're telling us that there's no COVID patients or very few patients, but now we can't get to see the doctor, and when is it business as usual again? So I think it's just about how we translate that information to, and that's probably through, you know, locally the CCG or whatever. But I was thinking about how positive communication has been, and we need it to be as good about business as usual, or trying to get back to business as usual, and for people that are trying to get in touch with their GP or whatever. So that's just a point linked to social media. And I think the other thing linked to social media, Jonathan, was about how brilliant it was that Bassett Workshop had a testing station, then Retford had a testing station. However, social media went nuts about the fact that it wasn't open on time, and then you have to book. No, you don't have to book. The communication through social media, whether, you know, clearly wasn't the correct information. So councillors and various people had to put that out, that about what was the correct information. But I think it's going back to the question, you know, the comment you made earlier about, you know, keyboard warriors are keyboard warriors and they will put stuff up, but it's about us being very clear at the outset of a testing station coming, you know, how we utilise all the existing social media to make sure it's clear, and it's, you know, like a one-liner or something, I don't know, something to stop this. One more last thing, but it's not about that, it's about the flu. When are we starting to give flu injections out, vaccines out? Because I've had, as a district councillor, not necessarily as my portfolio work, but people phoning me up saying they've had text messages about booking to have a flu vaccine, and then when they try to book it, it's not available until October or the end of October, or, you know. So on one hand, they're giving this information like go and get your vaccine, but then when they try and book it, they've got to wait for a whole month and a half, and it just seems to be that they're thinking it's mixed messages about the urgency of getting flu vaccine. So yeah, maybe that comes down to communication again. And I take the point from colleagues around on this meeting today about what we do to publicise that, and I thought the idea of a fellow councillor having a video, and I'll have a look at that with our Bassett Law communications, and maybe with Idris and the CCG we can do a little combo thing to do some promotion. But I think something is about mixed messages going out to people. So that's that really. Thank you.
Thank you, Sue. Some interesting points there. Jonathan, please.
Chair, I wonder if I could pick up the one around testing and perhaps invite perhaps Idris to comment on the one about communications from GPs, and it may be that Hazel Wigginton perhaps could help with the availability of flu vax more generally. I think those are probably NHS questions primarily, but in regard to the testing, the information going out around testing, I think there's probably two things for me in that. First of all, it's making sure that we get the information right first time, which clearly is important. And I think if we go back far enough, the first time we brought the mobile testing units to Bassett Law, we had a slightly a shaky start initially as we ran through some procedures for the very first time. So making sure that the right information gets out and is right first time is really important. The second bit, I think you absolutely underlined it again, and several people are making the same comment. We rely in all of this really heavily on our comms colleagues, and I think we might support them individually across all of our agencies were we to go back to them to inquire of them. What steps are you able to take? What innovative things can you think of? What channels should we be using to reach this segment of the population? How ought we to be addressing some of the misinformation and being more proactive about it? This is not to dodge the issue, but if you ask me, I'll come up with some rather a limited number of ways of addressing it that revolve around my listening habits, but not around the media habits of most people in the population. So I think we really rely on them. That's an action which we could each of us take away for all of our agencies, I think. Chair, if it was okay with you, I might ask Idris to comment on the one around messages from about GPs and primary care.
Yeah, thank you, Jonathan. Idris, would you like to comment on this one, please?
Yes, no problem, Chair. I think Councillor Shaw and ourselves, I think we're in communication already about this issue. I think my Deputy Victoria has already spoken to Councillor Shaw, and we're very conscious that it's really important that we get the clear messages out. GPs are open for business in terms of the activity that they're doing. It's pretty much as it was, but there is a change, and there's a lot more appointments taking place that aren't face-to-face, so telephone and sort of videos, and that's working quite well. And we've actually seen in many practices an improved access, shorter access to get a consultation with the GP. But of course, such a big change, I think it takes time to be understood by the population, for people to get used to it. And if they want to see the GP, but the GP feels that it really isn't necessary, they can do that remotely. I think there's an adjustment there that needs to take place in the expectation of the population. I think in terms of the flu vaccine itself, they're being delivered this month. I'm not aware there's going to be any delays. So practices will be looking at how they roll that out, but it is being prioritised. And as people know, the people who are entitled to a flu vaccine this year is significantly greater than it previously has been. And so, for example, if you're over 50, you can get a vaccine, but those of us over 50 will be in the later cohorts and not until later in the autumn. So initially, it will be those that are at greatest risk that the flu vaccine will be made available to. So communications are starting to be put out there initially by the practices who are planning ahead, because it is a significant challenge. Just to give you an idea, around about 40% of the population is going to be vaccinated, hopefully. And the increase is nearly 50% over the numbers that were being targeted last year. So it is a major undertaking. And I think the appointment offers that are being sent out now are preemptive to be made available towards the end of September, because the flu vaccines are still being delivered. So they haven't actually arrived in the practices yet.
Yeah, thank you.
Thank you.
Can I just come back for 1 minute? Because it wasn't a criticism, it's just at all about the surgeries. It's about the communication to say it's business as usual. And I think what we've been great at is communicating about COVID. And I would like to see that expanded to people being understood. And just a little point about the flu vaccine. It was the people that are the most at risk are the people that have been phoning me to say, I've been told to go, but I can't go until October. So it's not the general public like you and I, but that was just a point.
Yeah, I suspect Dr. Griffiths might have something to add to this, particularly in terms of the GPs being able to provide the vaccine and the timing of that.
Yeah, Jeremy, is it on this subject?
Yeah.
Hello, Jeremy. Yeah, go ahead, Jeremy.
Yeah, so I was just in terms of commenting about how the model of general practice has changed. I think it's fair to say that the established model of general practice of basically patients booking appointments with their GPs has pretty much been ripped up by COVID. There's no doubt that there's been an acceleration in the use of technologies to try and reduce the possibility of patients coming together under a single roof, often in large groups. The idea of packed waiting rooms has been something that practices have wanted to avoid because of the risk of spread. There's no doubt that the changes that have been made offer advantages, I think, to certain population groups. I've no doubt that people who are used to using IT, using video, using photography, does make a big difference for patients to not necessarily have to travel to doctor surgeries. I do have concerns, and I hope it's being monitored somewhere within the system that we're not widening equity gaps. Particularly for people who maybe are not literate from a technology perspective, whose English isn't the first language. Because I think what's actually happening, the reality of the situation is that we are now, historically, we probably would have seen 80% of people and dealt with 20% by telephone. I think from my understanding on the national figures, it's now reversed that completely. So we now speaking to people or videoing or having different types of contact with patients, but probably face-to-face contacts, it's only about 20%. And what that does mean is that if patients are complex, we can spend a lot of time with them. I spent 3/4 of an hour with one person the other day who had a particular 3 or 4 different problems. I was able to do that. It was particularly complex. There's no way we could have done that on the old 10 minutes an appointment system. So we're filtering to an extent. It does mean that we can also be more efficient. So there may be times when I may see a patient or speak to a patient, decide that I need to get blood tests done before I actually see the patient, so that I can actually have a better consultation with that individual with results in front of me. So there are pros and cons throughout the system. I just think we've just got to be mindful around the inequalities. In terms of home visiting, and I certainly know my own practice, we certainly do between 8 and 10 home visits a day. So that's using PPE, which isn't always easy. You know, using masks where people have got hearing difficulty is really difficult. But that's still happening. So, and we in the care home sector, again is being done remotely with visits to patients where it's absolutely necessary that the doctor has hands-on contact with the patient. It's challenging. It really is challenging. It's, you know, it's when you've worked in a certain way for the best part of 20 years and then that gets ripped up overnight, that's difficult. And people are still adapting to that, but we are getting more efficient, and we are, I think the public are understanding that what we're doing as well is maintaining a service, given that we're in the middle of a pandemic.
Thank you, Jeremy. Hazel, did you want to come in on this one?
I don't think I need to. I think Idris has answered
yeah, that's
Susan's
fine.
question, as long as she's happy with that.
Yeah,
okay?
Thank you. She's nodding thumbs up. Thank you.
Okay.
Jane Lawton, please.
Hello, thank you, Chair. So I really wanted to pick up again on the discussion around comms. I'm particularly communicating with the sort of people who are more difficult to reach. We decided at Healthwatch to try and get in touch with some of these people right early days. So in April, we did a survey of a large number of people who were classed as vulnerable. And I think the concern was that people were not getting the information they needed or didn't understand what they were supposed to be doing. And it was particularly the over 70s who really didn't understand if they were at risk or not. And now clearly that was at that point in time, and that was right at the beginning of the pandemic. But this is something that I'm concerned of how that's being kind of continued, and how we're learning about how to communicate with these people. And so I suppose I'd really back Jonathan's suggestion of going back to the comms teams with some questions and some about what they've learned and how they can reach some of these groups better to provide them with the information they need, because there's generally quite a lot of confusion around at the moment. Obviously, a lot of that's from the national messaging, but I'm just concerned that people don't actually know what they're supposed to be doing, and they don't actually know if they can see their GP and those sorts of things. So it's just a general point really about communication, which is incredibly difficult as everything's changing so quickly. I absolutely get that, but just concern at how we're reaching some of those groups who aren't on social media and who don't use computers and may well be quite bewildered by what they're supposed to be doing at the moment.
Thank you, Jane. Jonathan, please.
So I'm not sure that I've got anything to add. I'm listening. Yeah, and I note the challenge, and I think it is a challenge for all of us right around the table in terms of engaging our comms teams to consider. Here's another really important group, but for all of the different groups that have been identified in conversation this afternoon. Hearing from our comms teams about the innovative ways which we can be reaching them with the right messages.
Yeah, thank you, Jonathan. Councillor Henry Wheeler, please.
Hi, hello. Very comprehensive report, thank you. I just wanted to pick up on a few things related to children and young people from a professional perspective. I obviously been doing youth work and work in the school. It was a real pleasure to welcome back some year 7s today to school. So there's in the classrooms roughly like 30 children to a classroom. That was the standard today. But my question relates to vulnerable staff in schools and the flu jab, because what I'd like to know is what work are we doing with schools to try and get vulnerable staff in schools, or staff generally speaking, to have the flu jab, given that they may be at increased risk of catching COVID moving forward. And the other question relates to safeguarding, which is around obviously some people have been off school for more than 6 months. And within that time, they've probably seen quite a few of them have probably been exposed to an awful lot of things that they wouldn't wish on anybody. You know, a lot of young people may have been exposed to trafficking, drug dealing, domestic violence, all host of different things that will have impacted on their mental health and well-being. And my question is what are we doing to look at, you know, a possible increase in referrals from schools as children go back? What will the council do in terms of its children and young person services in terms of trying to respond to those increases in possible referrals from schools? So what resources have we got in place for that? The other issue relates to children that may be having to use public transport and crossing boundaries. So, for example, in Gedling, Rushcliffe, Broxtowe in the city, you've got a lot of young people that sort of cross boundaries and go to schools that are perhaps not in, you know, so you might have a city child going to a school in Gedling, or a city child going to a school in Rushcliffe, or a city child going to a school in Broxtowe. But my question relates to the possibilities, hopefully not, of, you know, a local lockdown if one happened, say, for example, in any of those districts or in the city, how that then might impact on that young person in terms of their education. Being in a district that might be affected by a local lockdown, but going to a school that's not affected by a local lockdown, how do you sort of square that up? And the other issue that I think a lot of schools are faced with at the moment is the mixed messages around PPE, particularly face masks. So different schools have different policies around face masks. Some schools are saying that children must wear them in corridors. Some schools are saying it's a voluntary thing. You can wear one if you want to. Some schools are saying that staff can wear visors rather than masks if they're teaching. There's all sorts of mixed messages there in terms of PPE. And my question is, how do we square that and try and resolve that issue around PPE within schools? That was it. Thank you. Thanks very much.
Thank you, Henry. Obviously, we haven't got the Corporate Director of Children's with us today, but Jonathan, can you answer that one, please?
I can have a shot at some parts of that of the questions. So, first of all, in terms of, I think it was flu vaccination for people in school, whether it was staff, I think you were mentioning specifically, or indeed children, depending on which groups you have in mind when you say vulnerable. These groups would be eligible in any case for free flu vaccination. So I would hope that the strength and promotions that will be going on nationally around the flu vaccination programme this year will ensure that we get a really good uptake from all of those, whether we're talking about children and young people or staff members. In terms of the council response to children and young people who've been off for 6 months and may have been impacted by various adverse experiences during that time off. I'm going to have to wait for, I think, for Colin Pettigrew to help me out with that response. But what I can say is that within public health, we've increased our investment, or are increasing our investment in some of the services which will either sustain or strengthen our response for children and young people presenting with concerns arising out of those sorts of adverse experiences. You asked about transport and crossing boundaries and local lockdown. So it's clearly a policy of national government to protect children and young people and their schooling at the moment. Our policy locally will be, as I said before, to prevent the need for any form of local lockdown. And I know that my colleague in the city will say that as strongly in terms of the city as I do in terms of the county. Were it required, we would of course be ready to implement it, but it's clear again from guidance that was released late last week that the government would seek to limit the impact on the schooling of children and young people. So they would seek to enable children to travel to the schools that they need to get to in order to carry on with their education, and that it's really in the most extreme circumstances that schools would be closed down and learning coming to an end. And then finally, you talked about PPE and face masks. I think the risk of being a pedant here, I'm going to talk about face coverings. It's not PPE we're talking about. It's not face masks in most of these schools that we're referring to. It's face coverings, and government clearly has taken a decision that they wish to enable school leaders to do what they can locally to reassure parents as much as they can, and to give discretion to school leaders themselves about what is done in a particular community and in a particular school and within a particular age group. And I don't think I want to add to that at this stage.
Okay, thank you.
Thank you, Jonathan. Perhaps we could ask Colin Pettigrew, the Corporate Director, to provide a written response to everyone regarding that last question, if that is okay. Is that okay, Henry?
Yes, thank you.
Thank you. Thank you. That's the last speaker. There are no other speakers. So is everyone in agreement with the recommendations, please? Anyone against? Thank you. That's been passed. We'll now move on to item 6, which is on pages 35 to 46 of your agenda pack, and that is the work programme. And the recommendation is that the Health and Wellbeing Board's work programme be noted and consideration be given to any changes which the board wishes to make. So we'd like to direct your attention to the board's work programme, which is included in Appendix 1. COVID-19 continues to demand significant resources from all of our organisations, as we're all fully aware of. Because of this, there are a number of items we've not been able to reschedule, and these are listed again on pages 9 to 10. We would like to reassure members that work is underway to identify timescales for these items, and these will be brought to the board as soon as is appropriate and feasible to do so. Since the papers have been published, we've had confirmation that a Better Care Fund performance update for Q4 will be provided at the next meeting, which is, of course, is on the 7th of October. So would members like to comment on or request any changes to the work programme? And then I'll bring... I've had no hands go up. Ed, would you like to comment, please?
Oh, thanks, Councillor. Yes, members will be aware at the last meeting, it was agreed that we would have another board meeting in October rather than a workshop. So we normally alternate between meetings and workshops, but because of the backlog of items caused by coronavirus, we agreed to have a meeting. So we'll have another meeting on the 7th of October, another meeting on the 4th of November, and then a workshop in December.
Thank you, Ed. Everyone in favour with that recommendation? Thank you. Thank you very much, everybody, for your contribution. Sorry, Jeremy, go ahead.
Yeah, sorry, it's just at some point, Councillor Harper, could we have some feedback from Jonathan, just in terms of, I guess it's some sort of risk assessment of the impact of the replacement of Public Health England with the National Institute for Health Protection, whether there's any implications for the work programme going forward in terms of how local authority public health integrates with that. It would be useful just to have some assurance.
Yeah, thank you. Ed, could you include that on the work
now, but at some point in the future?
Yeah. Yeah, I'll get Ed to put it on the work programme. Just if that's something you can get. Thank you. That's all sorted. Big thank you to everybody for all your contributions today. We've had some really complicated, lengthy questions and some really good comprehensive answers. So thank you very much for all your contributions. Joyce, do you wish to make a comment?
Yeah, just a quick one. And it shouldn't be immediate, and I can't see that happening anyway. But it refers back again to something that Jeremy said about the impact of people with coronavirus and the impact on those individuals who would normally be going to the GP surgery and didn't, and what has that done to their health. So I don't know when we can look at that, when Jonathan's likely to have any figures for that, but I think it's something we should be mindful of. So it's the impact on people with coronavirus and those in general health and how it's affected them.
Yeah, thank you, Joyce. That's a good point. Jonathan, is that something we can do, please?
Yeah, I think we should do that. Ed may be more up to speed with the state of the conversation than I am, but I think we've had some dialogue with colleagues within the local NHS, the CCGs, about understanding the impact of coronavirus on healthcare and its associated outcomes. So they too are, I think, quite hard pressed, busy with dealing both on one hand with response and at the same time with recovery. But I think that is something that that we'll want to ask them to come back to the Health and Wellbeing Board with. Thank you for the reminder.
Thank you, Jonathan. Ed, do you wish to come in on this one?
Thanks, Councillor. Yes, we're hoping in the work programme under the 7th of October meeting, so for the next meeting, we are hoping that the CCGs will have a report on the indirect impacts of coronavirus on health outcomes and access to healthcare. So that's something we are in conversations with the CCGs about, and that is hopefully something that can be brought to the next meeting.
Thank you, Ed. It's important, everybody, that this is your chance to put things on the work programme, and thank you for your contributions to it, because this is your meeting and we discuss what you want to discuss. So thank you very much for that. And we look forward to seeing you all virtually, at least, at the next meeting on Wednesday, the 7th of October, 2 p.m. Thank you. The meeting is now closed. Thank you.